Hello, and thanks for joining us for this video case tip. I'm Brynne McBride of ABC for Health. Today we're taking a look at Medicaid block grants. What does it mean to block grant Medicaid? First, let's refresh our memory, though, on how Medicaid works right now. I think this is a good starting point for any conversation we have about potential changes to the program. Right now, Medicaid, of course, is the nation's public health insurance program. It's for low-income folks and folks that meet disability determination requirements. It covers 73 million people. A lot of the gains in Medicaid coverage in the past few years have been from the Medicaid expansion. It has resulted in more people taking advantage of Medicaid program and getting connected to care. It's the principal source of long-term care coverage, and that sometimes is overlooked when we talk about the Medicaid population generally. It provides reimbursements to hospitals, community health centers, physicians, nursing homes, clinics. It's a big provider reimbursement source. And this gets overlooked a lot of times when you hear complaints that Medicaid reimbursement rates are low. If you ask most providers, they would tell you they would rather have a Medicaid reimbursement than no reimbursement. The Medicaid program also finances 16% of all personal health care spending in the United States. It's a big percentage of what people have come to rely on for health care. Now, Medicaid is a federal-state program. It's a federal-state partnership, if you look at it in those terms. This means that the program is subject to federal standards, but states have some leeway and flexibility in the design and administration of the program. Because it is a state and federal partnership, you can see that also dictates how the funding stream runs. The federal government matches state Medicaid spending, and this is on an open-ended basis. There's no top limit on how much that can be spent on the Medicaid program. It's largely determined by need and by enrollment population. So, what does it mean to block grant Medicaid? Well, this proposal has been thrown around over the last several years. This is not a new proposal. It was even introduced when Ronald Reagan was president. It never came to fruition because people enjoyed having Medicaid as an entitlement program that had that open-ended nature to it. It's come up in most recent conversations about a cost savings measure when we talk about restructuring the way Medicaid is run right now. It would mean scaling back the federal contribution to the states and setting an upper limit, but not just an upper limit overall, setting an upper limit on how much the federal government gives to any one particular state. This is the centerpiece right now of proposals that you've seen coming from House Speaker Paul Ryan, from the Health and Human Services nominee for Secretary Tom Price, and a couple other proposals that have been circulated over the last couple weeks. Now, the block grant itself would potentially roll back eligibility. Because you're getting rid of the requirement that Medicaid is an entitlement program and you're limiting how much money goes to each particular state to help support their Medicaid program, the natural result is a rollback in eligibility. States don't want to be saddled with the cost of running a Medicaid program for existing enrollees as if it were an entitlement without the federal contribution to help support that. So that naturally means rollback of eligibility. If states are given an annual fixed amount to spend on programs, you could see program enhancements perhaps being rolled back. Right now in Wisconsin, children are eligible for Badger Care Plus up to 306% of the federal poverty level. That is more generous than what the federal standard requires. A potential rollback could mean cutting children from the program. Speculation, but that's an example of what a fixed amount might mean for eligibility. Federal funds would be fixed amounts and would grow at predictable formula-driven rates from year to year, or not at all. This is not a per capita cap, a different proposal for Medicaid spending limits, which means that it's not determined by how many people are enrolled in the program. Once a limit is set, it's set, and then it can only grow by a pre-prescribed limit, or some states might say, we don't want it to grow at all over time. Shortcomings of block grants. There are a lot of shortcomings. The first one is it's not an entitlement program. You take Medicaid out of the world of entitlement and you say it's just for what the budget will allow this year. People are not, therefore, entitled to services under a block grant arrangement. They would not automatically take population growth into account, and it disconnects the level of funding from the number of Medicaid beneficiaries and the actual cost of providing care for those people. Now, federal rules regarding eligibility, coverage, and payment would need to be substantially restructured or repealed if you were to start funding Medicaid in this format. The Congressional Budget Office has weighed in on what some of these proposals might look like. They estimate that proposed legislation that includes Medicaid block granting would save the federal government $1 trillion over the next 10 years. That savings is cost realized by kicking about 14 million people off of the Medicaid roster. We've got a lot of sources. A lot of people have weighed in on this topic. We list them here. You can click on the information button to read them for yourself. That's a topic that we're going to be talking about a lot more in the days to come. So keep tuned to this webpage, and we'll keep you current with all that we know about the changes to the Medicaid program on the horizon. Thanks for joining us.